Australian Paul Krause is somewhat of a legend amongst cancer patients. In 1997, he was diagnosed with peritoneal mesothelioma, a form of cancer that affects the lining of the abdomen. Generally, the prognosis for any patient with this disease is anywhere from 3 to 12 months. Today, 11 years later, Paul Krause remains alive and well. He attributes his survival to numerous factors, including traditional Chinese medicine, or TCM, visualization, and prayer. But in his book, Surviving Mesothelioma and Other Cancers, Krause also writes extensively on the topic of supplements. Among the many forms of complementary alternative medicine, the use of supplements, mainly certain vitamins and other plant and animal-based substances, appears to show the most promise based on medical research. What are supplements? The more accurate terms for these substances are dietary supplements or nutritional supplements. These terms are most often associated with vitamins, but can be any product added to one's normal diet. In addition to vitamins, these may consist of minerals, herbs, and plant extracts, amino acids, and enzymes. It is possible, and perhaps even preferable, to obtain these vitamins and minerals from food. However, this can be difficult for many cancer patients. While supplements are not a substitute for necessary protein or sufficient caloric intake, they can make it easier to obtain necessary vitamins and minerals that may otherwise be missing. Which supplements are best? A recent Japanese study suggested that the antioxidants found in berries, specifically boysenberries, had an inhibiting effect on the growth of tumors, particularly those associated with mesothelioma. The boysenberry, a hybrid of the raspberry, blackberry, and dewberry developed in California over 80 years ago, has a particularly high concentration of the antioxidant polyphenol, which is also found in tea, beer, red wine, olive oil, chocolate, walnuts, and peanuts. Getting such antioxidants from food sources is one thing, but taking them by themselves as a supplement in concentrated form may not be a wise course of action, particularly for patients undergoing chemotherapy and radiation treatments. What are the dangers of supplements? Because many Americans lack access to free health care, it's understandable that as many as 80% of all Americans turn to complementary alternative medicine, including dietary supplements in treating their illnesses. Nonetheless, there are risks associated with the use of supplements. And simply because something is labeled as all natural or herbal does not necessarily mean that it is safe. For one thing, most of these remedies and supplements are not tested nor regulated by the Food and Drug Administration. It is also important to keep in mind that many such herbal supplements are essentially diluted from the same substances as prescription drugs, but have not been reviewed for safety. Some of these herbs can cause unpredictable interactions with chemotherapy drugs or other standard therapies. Use supplements cautiously. Herbalist Robert Rister, a self-professed conservative in matters of alternative medicine, has written 9 books on the topic of natural remedies, including Healing Without Medication. On his blog, The Home Remedy Companion, he writes that while nutritional supplements are great in some circumstances, mesothelioma, for the most part, isn't one of them. However, he has stated that vitamins in the folic acid group and vitamin E can be effective in offsetting the toxicity of chemotherapy drugs such as Pemetrexed disodium. On the other hand, mesothelioma patients should avoid calcium supplements, vitamin D, and shark cartilage, which can weaken bone and cause other undesirable side effects. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.